Hey everybody, welcome back to the channel. We have some new breaking news. We've got a lot of breaking news on Palantir over the past month of September. We are starting off October with a bang, so let's get into it right now. I'm going to put it right here in the corner so I'm not overtaking the news. Palantir and Concordance. Oh, there we go. Palantir and Concordance announced partnership to power first fully integrated medical supply chain ecosystem. This is a really interesting piece of news, so we're going to get right into it and start going deeper into it. Palantir Technologies, a leading builder and operating systems of the modern enterprise, and Concordance Healthcare Solutions, one of the largest independent healthcare distributors in the U.S., located in Ohio, today announced a partnership to power the first fully integrated medical supply chain ecosystem, bringing together inventory and supply chain data from manufacturers, suppliers, distributors, and providers into one cohesive real-time system. Now, this is really interesting, especially because it has to do with the medical ecosystem and supply chain ecosystem, and we know the role that Palantir played in COVID-19, so let's kind of see what they have to say here. One of the biggest challenges in healthcare today within the supply chain and the root cause is the management of data associated with the critical supply chain workflows. That's one of the reasons why there's a lot of challenges. COVID-19 exacerbated these long-term standing issues, causing further shortages, back orders, and extreme spikes in demand for certain products, highlighting the lack of visibility between healthcare supply chain partners and their different distributors. Today, providers still face unpredictable availability and lead times for essential life-saving supplies, while manufacturing distributors face unknown provider demand planning. Recognizing the industry is in a position to adopt new solutions to overcome this enduring obstacle, Palantir and Concordance have come together to build an ecosystem that can handle diverse sets of disparate enterprise resource planning tools, regardless of compatibility, to create one agnostic point of reference. Basically saying there's a lot of data, a lot of different places around the supply chains, around the logistics of a hospital, of a Medicare ecosystem. And if we could put all that together into a agnostic point of reference, agnostic means it doesn't matter where it's coming from, it's just in one place, then that could potentially be powerful. Powered by Palantir Foundry, the new ecosystem is accessible to any healthcare manufacturer, supplier, distributor, provider, or government public health agency with a license. So that is very interesting that they're putting all of those different stakeholders into one thing, and that allows them to use the platform. Those utilizing this new supply chain platform will have access to the ecosystem's live inventory data and supply chain signals within an actionable interface, meaning complete line of sight and proactive signals to supply chain information at each stage from production to point of care. Palantir's world-leading information security also means that the data is only viewable and actionable by those with appropriate credentials. Issues like product back orders and substitutions that historically could take hours and resources from frontline staff can be remedied within minutes. Ultimately, this improves patient care and reduces the burden on healthcare providers. And we also saw that Palantir has been doing this with the NHS. A couple of months ago, an article was released that they've reduced the backlog by about 28% in the NHS. The NHS does not have private insurance. They have nationalized insurance. So there's a lot more backlog because at the end of the day, the system is not as effective as a free market system. So if that's the case, you need a company that is using software to effectively manage and integrate all of those different points of data to reduce the backlog and actually allow patients, which are the people that the healthcare system is supposed to be helping in the first place, be able to get their meetings, be able to get their medicines, be able to get their prescriptions, all of the stuff that they need to get in a more efficient way. Which is why hopefully that the NHS deal that's worth about 360 million pounds over 5 years is going to be going to Palantir, but we'll see when an update comes out on that. Now, from the CEO of Concordance, the launch of this ecosystem represents a vision to fundamentally change the medical supply chain at its core, and not just for Concordance, but for manufacturers, supply chains, suppliers, distributors, and providers across the board. Palantir has proven to be the perfect partner to make this vision a reality. There is no doubt that healthcare providers lacking certain medical supplies and access to the appropriate data to replenish those supplies put patients' lives at risk, and we are excited to be on a mission to change that. By enhancing the visibility throughout the supply chain for all partners, the ecosystem allows manufacturers, suppliers, and distributors to better prepare for what providers will need versus react to what providers need when it's oftentimes too late. Ensuring doctors, nurses, and other essential staff have been pretty much supplies to provide the optimal care for every patient is exactly the type of critical problem that Foundry was built to solve, said Shyam Sankar, the COO of Palantir. He also says, "We are thrilled to be on this journey with Concordance to bring the power of data and operations together to grow this new ecosystem for greater good." Now, one thing about the healthcare industry in general, today the ecosystem development is focused primarily on the foundational supply chains challenges that exist in the industry, enhancing visibility upstream and downstream to bring real-time information and data to all users for faster, more informed decisions. Looking forward, we aim to add additional workflows and logic to the ecosystem to dig deeper into the healthcare supply chain challenges that oftentimes expand beyond Palantir, beyond supply constraints. And Palantir software is currently deployed in all areas of the healthcare value chain and beyond, including life sciences, pharma, biotech, clinical research, and healthcare operations. Why is this super interesting? A couple of reasons. Number one, it's a new deal, and obviously having a new partnership with a new medical systems provider is really interesting. The reason I invested in Palantir was not because of the governmental revenue, although, we've gotten $712 million of confirmed governmental deals as of September 2022. That wasn't my bull case. My bull case was understanding that if this software is commercially available in every single vertical that exists on the planet, then we've got a massive opportunity here to expand the software, and I can get in on the early stages as the software is brand new and people really don't understand the software. Partnerships like this with Concordance makes me feel more excited, because when you think about a healthcare provider and all the different systems that exist in order to provide healthcare, you think about how that can become more efficient and more effective and actually have a tangible impact, not just some random software that people in the hospital have to use because they're forced to use it, but an actionable insight to be able to make real-time decisions that are powered by data to do something meaningful for your patients, which at the end of the day is the point of the healthcare system. Palantir integrating with them from a supply chain and logistics perspective makes a lot of sense. COVID-19 obviously showed that there is a gap between how many things we have in the hospital, how many things we have from our distributors or our suppliers, and how we can all integrate that into one place to be able to make this make sense. I think Palantir has shown an effective way of solving a lot of these problems as of what they've done in the COVID-19 vaccine distribution process. And I think they can do it in a lot of other commercially available areas, which is why Karp says bad times are good for Palantir, because they can showcase in stress test moments when you need something to get the job done right now, Palantir is able to get the job done, which is why, it just makes me very, very bullish. The second reason I think this is interesting is because Shyam Sankar a month ago went on Bloomberg Technology and said that Palantir is probably the most undervalued healthcare tech startup in the world. And you ask themselves, why is this the case? Well, if you think about all the verticals they exist in, healthcare is a very big vertical, from biopharma to clinical research to actual hospitals being able to process the care that they need for their patients. If Palantir software plays a role in all those industries, and we already know they're working with some companies for drug discovery and obviously different things in the biopharmaceutical space, then there's a massive opportunity here. Healthcare is a $4 trillion market. Palantir doesn't need all of that. They just need a really, really tiny percent of that to be able to deliver some shareholder value. If they're able to integrate their services within a lot of different areas in the healthcare space, which is a space that's only going to keep growing, that only expands their total addressable market. And it's partnerships like this with Concordance that not only serve as a case study for the next 5 years going forward, but also indicate to a lot of the other hospitals and medical distribution centers in Ohio that, hey, this place is using Palantir and they're more faster, they're more effective, they're more efficient, they're getting stuff done, people are more happier, the patients are nicer, they're making more money out as a result of it. Maybe we should try them. And then maybe, it's just this flywheel effect that only keeps expanding and compounding upon itself. These are partnerships I like to see. These are partnerships that shows that Palantir is getting deals done in really strategic areas. And those strategic areas, if those deals actually manifest themselves into the highest potential that they could become, then you've got something that's looking really good. Now, is that going to affect the stock price? Stock price is up about 0.27% today. Nothing that insane. I don't expect it to help the stock price. I'm thinking, okay, at $8, if they're making these deals, can we get to 20, 30, 40, 50 bucks one day, because these deals serve as a precedent to be able to get more of these deals and actually establish the infrastructure of their software being used in a variety of different verticals. And I think, these are the deals that show that it can be done. So Palantir Concordance partnership, let me know what you guys think. I thought it was a very, very interesting partnership, and hopefully it's just going to get bigger and bigger as they expand in the biopharmaceutical space. Thank you so much for listening and watching. I'll see you in the next one.